Chapter 17 is on nutritional considerations for special population groups. So when we're talking about special population groups, what we're referring to are people who have unique conditions, diabetes, HIV, developmental disabilities, and so on and so forth. So let's start with this statement over here. We're saying, you know how when we offer oral hygiene instruction to our clients, we make it unique, right? So if our clients have like gaps in their teeth, if our clients have dentures, if our clients have implants, we're going to teach someone who has dentures. The oral hygiene instruction is going to be different for someone who has dentures compared to someone who has implants, for example. It's client specific. So same thing applies with nutritional counseling. We got to look at the client as a whole, determine what conditions they have, and then based on the conditions they have, we will make our nutritional recommendations. So it is client specific. And when I say client specific, what we're doing is we're looking to see what oral concerns do they have. Maybe they have TMJ issues. Maybe they have ulcers in their mouth. And so based on what we see, based on their assessment, we're going to provide the appropriate feedback. Sometimes we have to look at their physical and mental ability. Can they actually hold a toothbrush? Are they mentally, can they actually understand, or do they have a developmental disability? And then how can we help them? We have to figure out what client likes and dislikes. So when we're making recommendations for food, think about when you make those food recommendations, think about what the client likes. Work with the client here. And the client will tell you what they like, and then you can give strategies and you can give suggestions as to what food is good and what food is bad based on their likes and dislikes, and also based on their lifestyle and living arrangements. So sometimes seniors, for example, some of them can live by themselves, and they may not be, they may not want to cook for themselves. So take all that into consideration about what are some easy meals that they can cook. Because at the end, we are responsible for our client, right? So we really owe it to our client to understand them as a whole. Don't understand them don't just look at their mouth. You got to look at their whole, look at a person. Look at them as a person. So what do they like? What do they dislike? Where do they live? What's their lifestyle like? And based on what... And that's actually going to come naturally, because you're going to see your client every so often, every 6 months or every 3 months, depending on their recur, and you're going to form a great rapport with your client, especially if you stick with that one office. So you'll be able to understand them as a whole person, not just their mouth, but you'll be able to build a relationship with them. If your client has any disease or even a disability, research. Go look at reliable websites. Look at evidence-based journal articles to figure out about the link between disease and oral health. The textbook says, have like a folder with all those information, and then divide it accordingly. Make sure it's nice and organized. Or if you have a computer, put it in a folder in your computer, so that anytime you have this client that has diabetes or HIV, you know what recommendations to make. Perhaps you could have a handout ready so that you could give it to them. You can print it and give it to them, so that you're aware that you're aware about the nutritional recommendations, and you're giving them the correct ones. That's what's more important. So we're going to see wounds all the time. We're going to see periodontal disease. We're going to see inflammation. We're going to see extraction sites. We're going to see sores, denture sores. And so because we see the wound all the time, for the wound healing to occur, for proper wound healing to occur, you got to have the right nutrients. The good nutrition will lead to good wound healing. And so, like I said, we do see oral wounds on a daily basis. Sometimes stress can cause it. So if you're biting on the lips or on your cheek due to stress, and it's leading to a wound. Sometimes infection, we see infections, so dental abscess, for example, or tissue injury, so gingival curettage, where when we're scaling, where the gums are also getting removed as well, it's getting curettage. So these are all examples of wounds that can happen. And so all of these examples, we need the right nutrients to heal the body. Without the right nutrients, it's going to take a longer time for the for the wound to heal. Okay, so when we're looking at what we should eat to heal wounds, protein is important. When you eat a lot of protein, your wounds will repair and heal a lot faster. if you have a fever, your metabolism increases. So your metabolism increases when you have a fever, which means that when you have a fever, more calories are burnt in your body. And so when there's more calories that are burnt in your body, that means you need more nutrients, right? Because you're burning a lot of calories, so you need more nutrients. In fact, the amount is 12%. You need 12% more calories. And those calories should be good, healthy nutrient calories. Now, these are all the different surgeries that are out there. Bone grafting, tissue grafting, pocket reduction, crown lengthening. These are things you'll learn in perio. I have a video actually talking about these different surgeries. But what's important to know is when your clients are going for these surgeries, we need to think about diet suggestions. What can we recommend for these surgery clients, for these clients that are going through surgery? So as soon as they have their surgery, whether it's bone grafting or gum grafting, for 3 to 5 days, avoid spicy food because it's going to just aggravate that area. Salty food, crunchy or hard food because it can, the stitches can get disrupted. That area where the surgery is can get harmed with crunchy or hard food. Nothing really hot that can burn that area, and no alcohol. Alcohol dries out the mouth. It just does more damage than good. So this is what you can recommend for clients who are going for surgery, for periodontal surgery, or even oral surgery. Avoid these food for 3 to 5 days. So let's look at extraction. If you get an extraction, we tell people to not smoke and not suck through a straw. Because if you smoke or suck through a straw, especially sucking through a straw, what can happen is there's a blood clot here, it'll get disrupted and it'll create a dry socket, which is really, really painful. So avoid sucking through a straw. Lots of fluids. As it is, you're probably not going to be eating a lot, so we don't want to get you dehydrated. So we want you to drink lots of fluids. It's going to hurt. So eat only soft foods for the first 12 to 24 hours. And if this is where your extraction is, you're going to chew naturally on the opposite side. Here's a picture of necrotizing ulcerative periodontal disease. So necrotizing means necrosis, the tissue death. So tissues look like it's dying. There's ulcers. And so when this happens, here's a severe example. You can see the gums are really red. You just touch it and it starts bleeding, so spontaneous bleeding. This is one of the only conditions where clients will come to you with gum pain. So they're in a lot of pain, they can't eat. And you can look at how bad this looks, right? This is obviously a severe example. But this is the unique, there's so many periodontal diseases, usually a silent disease because you don't feel any pain. But this one, you do feel pain. Necrotizing ulcerative periodontitis, you do feel pain. And then because it's so inflamed, you're going to be feverish, your lymph nodes will be swollen, and you're going to feel very tired. So if you have a client who has NUP, what can you recommend for diet? Remember, if you have a fever, you're going to be burning more calories, right? So you need to increase the calorie intake. So, and I know it's very painful, so maybe eat a liquid or soft food diet. So when I say soft foods, these are some examples right here. Broth is a great example, jelly, custard, something soft. You don't want to have anything spicy because that can irritate the gums. So choose bland foods with not that much seasoning in it. Eat small, frequent meals, drink lots of fluid. Last thing you want to do is get dehydrated. And then because you may always take a vitamin or mineral supplement because vitamins and minerals are excellent because they help with wound healing. They help you just feel healthy. And because, interestingly enough though, when you have NUP, okay, so when you have this condition over here, it's, as we said, there's lots of pain involved, right? So you're not going to be able to chew and grind properly. And sometimes the food we eat is limited because, it could be because they lost a tooth. It could be because some teeth are mobile, they're loose. It could be, TMJ issues. They have jaw pain. Maybe they're wearing dentures. And so it could be hard to chew for many different reasons. When we have all our teeth, we can chew up to 200 pounds, which is a lot, of course. But when you have dentures, okay, you can't chew up to 200 pounds. You can only chew up to 25% of 200 pounds. So it's very little. And so new denture clients, they need to, when they put this on, it takes them a while to learn how to talk, to learn how to chew. It's a whole new ballgame for them. And when they wear dentures, and they start eating, they're going to notice that their flavors, it's not the same. And that's because it's all covered. The denture kind of masks the flavors, so they don't enjoy eating as much as before, where you could actually taste the food. It's a little less this time around with the dentures. So if someone just got dentures, you want to cut the food into small pieces, chew on the food on both sides, this side and the other side, because if you just chew on one side, the denture will start to rock and tip, which you don't want. And so initially we're going to start with soft food, so eggs, fish, soft veggies, cooked soft veggies, pudding. And then once they get comfortable with their denture, then you can progress to hard foods. So in the beginning, just don't have anything sticky or hard, just eat something soft. Now this is extremely important. When they eat something hot, the denture, okay, you know how the denture has the palate that is, let me show you a better picture, that is covered? So if you eat something hot, you're not going to feel it because it's covered by the denture. You're only going to feel it when it goes down your esophagus. And so it's really important that we are careful when we have new dentures. We're careful. We're looking at the temperature first. We're examining the temperature because we do not want it to burn as it goes down. And it's kind of hard to do with the denture, right? Because the palate is covered with the denture, so you can't really feel the heat. So TMJ, let's shift gears here. We're going to look at TMJ. So TMJ, Temporomandibular Joint Disorder or Dysfunction. This is when you have pain in this area right here, in your TMJ area. And this could be because we're grinding. This could be because we hurt ourselves in the face or head and neck region. It could be because of stress. And so the pain kind of radiates in the ears and the face and the neck and the temporal area, where the temple is. So if we have pain, we're going to avoid food that requires wide opening. So like eating a big hamburger where you got to open really wide, you're going to avoid that. Try liquid supplements like Ensure, right? Something like that can give you the nutrients you need until the pain subsides, so until you can eat, basically. So you're going to eat a soft food diet, nothing hard because it's painful, and just try to, eat several small meals a day, but soft food, and you have liquid supplements. People with braces, some food can, break the brackets. It can loosen the bands, and it can even, bend the wires. And as it is, it's really hard to clean around the brackets. It's really easy for plaque to kind of get stuck in there. So when you have braces, and I'm guilty of this, I have, wires on a lingual wire. And what happens is, I have broken it so many times because I eat something hard and then it breaks and then I have to go to the office. It's just a hassle to book an appointment, go to the office, get it repaired, pay. It's just, too much work. But here are things that we should avoid when we have braces. Popcorn, especially these kernels, because they're so hard. It's easy for the brackets to break. Anything hard, nuts, ice, corn on the cob, right? The caramel or that tappies. And soda. Soda is acidic, right? And so acidic, it will weaken the enamel and it'll just cause more damage to the teeth. So again, these are more hard stuff that you want to avoid. Lemon, because it's acidic, and acidic environment is not good for the teeth because it will make your enamel weak. And as it is with ortho, we're struggling with oral hygiene because it's very easy for everything to get stuck. So if you have lots of plaque plus an acidic environment, that's like screaming for cavities to happen. So we want to avoid that. Okay, so let's look at diabetes, cancer, and HIV. So we're going to start with diabetes. If you're over the age of 65, 20% of the adults over the age of 65 is actually diabetic. Most of them, majority of them, are type 2 diabetic, which means that they need to take medications, they need to exercise, they need to watch their, eating habits, because type 2 diabetes is actually, for the most part, reversible. So if they control if they can take their medications, if they exercise and watch what they're eating, they can actually reverse it, and the type 2 diabetes goes away. The type 1 diabetes you're born with, so that cannot be reversed. Now, what increases your chance of getting diabetes? Well, the older you get, the more risk of having diabetes. If you're overweight, if we're not exercising, if we have high blood pressure, if there's a genetic If your parents or grandparents had it, like all of this play a role as to why someone can get type 2 diabetes. So when you have a diabetic client, you can educate them about like what can happen in the mouth. So sometimes you can get like red patches, like burning oral tissues. We know that with diabetes and periodontal disease, there's a strong link. So if they have uncontrolled diabetes where they're not watching what they're eating and all that, and their numbers are like really high or fluctuating like crazy, they're going to be at risk for perio or for periodontal disease. And then dry mouth. So anyone who's diabetic can also have dry mouth. So those are the three things that can show up in their mouth. So if you have a diabetic client, encourage them to drink lots of water. We can't necessarily make nutritional recommendations because we can talk about the cavity part, but the physician or the registered dietitian should be making the dietary suggestions as to what they should eat because they're more qualified. We can tell them to take multivitamin supplement. And this is what we can talk about, like eating cholestatic food. So food that prevents cavities, like nuts, because it increases salivary flow, anything hard, right? Raw vegetables, something hard and crunchy, it increases salivary flow. We like it when we have more saliva. More saliva means it washes off all the sugar in the mouth. And then milk and cheese are a great source to kind of cut down that acidic environment. So cancer. Let's look at what happens with cancer. When someone is going through treatment for cancer, there's lots of side effects that can happen with radiation and chemo. So they won't feel hungry, it's hard for them to swallow, they're going to have ulcers in their mouth, they're going to feel nauseous, constipated, or the opposite where they could have diarrhea. And their taste, they could have a metallic taste like this in the mouth. So when you look inside their mouth, it's going to look dry, possibly, and they're going to have ulcers in their mouth. So let's look at xerostomia first. When you have dry mouth, what we recommend is eating moist foods. So like food that have extra sauce, extra gravy, food that is moist so that we can easily eat it and we can easily swallow it too. So when you have food that's runny, it's easier to swallow. Sugar-free hard candy is really good to suck on. Make sure it's sugar-free, because whenever you're sucking, you're encouraging saliva to come in your mouth. Frozen food is also good. Anything hard, right? Because it helps you bring saliva into your mouth. And just like stay hydrated. Just sip water all the time throughout the day. It washes away your mouth, all the bad stuff in your mouth. Ulcers. So when we have ulcers that look like, this, like aphthous ulcers, for example, canker sores, or ulcers that can even happen after cancer treatment, we're going to have to eat soft food. We're going to avoid anything spicy, salty, because that's just going to aggravate that ulcer even more. Anything that's vinegar, like anything that has vinegar, citric, all of these things are going to upset that ulcer. Ice chips are great because they actually numb the mouth so that it feels so much better when you have something cold. And then a straw. If you're drinking something, don't let it touch the gums. Don't let it touch the ulcers. Let it go straight in. Let the drink go straight in. So use a straw so that you can, it's easy for you to drink and it doesn't irritate the tissues. This is HIV or AIDS. So HIV and AIDS, this is when your immune system doesn't work as well. You're prone to getting sick because your immune system can't kill all the bad stuff in your body. So we can get several conditions that can happen. This one, what we're looking at here, this purple raised lesion, this is Kaposi's sarcoma. So this can happen. This is linked with HIV. Same thing with necrotizing periodontitis. We saw a picture of necrotizing periodontitis where the tissues are really bright red, like a spontaneous bleeding. Gums are so red and heavy and inflamed, Candida, this is like a white, you can get white thrush on, areas of the mouth. Aphthous ulcers, this is canker sores. You get canker sores. So all of these can happen when someone has HIV or AIDS. So, when you have HIV or AIDS, you're taking 3 to 4 different types of medication, which we call a cocktail, because there's multiple types of medications you're taking. And so this medication, what happens is you don't have that desire to eat. And so, you could be anorexic, which means you don't have that, you just have abnormally low body weight because you're not eating. You could feel nauseous. You could even have a dry mouth through all that medication that you're taking to help you manage HIV and AIDS. So what do you do? What do you eat? Well, you can eat. What tends to happen, what clients tend to do, is they eat food that gives them lots of energy. So like milkshake, pudding, ice cream. But remember, these could be carcinogenic, right? These could cause cavities because there's a lot of sugar in them. So this is what we recommend. We recommend that they drink lots of water so they're hydrated. Increase that calorie intake, because when you increase the calorie, what happens is, as long as it's healthy calories, the vitamins and minerals can actually do good and help with the healing process, help you manage your HIV and AIDS. So protein is excellent. Liquid supplements, suck on ice to numb tissues. Eat a bland diet like this, and avoid alcohol, because alcohol is never good, especially when you have conditions like these, like HIV or AIDS. Okay, let's look at the next three. So developmentally disabled, homeless, and substance abuse. Some clients could have autism, some clients could have cerebral palsy, vision and hearing impairments, Down syndrome, where, all of these are impacted. They might not be able to speak, they might not be able to move, they might not be able to take care of themselves or live independently. And so we're concerned about them, especially dentally, we're concerned about them because they're at a higher risk for cavities because they can't brush their teeth that well. They might not, they have poor eye-hand motor control, which means that they can't really see. So poor eye-hand motor control, that means they aren't able to brush and floss effectively because they can't see maybe, and they can't have control of their hands. And sometimes it's hard for them to go and see a dentist because they need special transportation to get there, or they can't afford it. So if we have someone who has a developmental disorder like Down syndrome, autism, CP, cerebral palsy, remember that we want to keep the sessions very simple. So just give them one recommendation and then work with that one recommendation. Don't overwhelm them. Just small changes is good enough. Some parents who have children with autism may put them in a special diet, like a gluten-free diet, for example. And so whether you agree with it or not, don't interfere. Let the doctor deal with that. But what you can focus on is the carcinogenic aspect, right? So if it is causing a lot of cavities, you could talk about that. Encourage them to eat foods with lots of color. The more colorful the food are on the plate, the more healthier it is. Let's look at homeless clients. So lots of people are homeless. That could be because, they don't have a job. It could be because they had to run away from home. It could be because they can't afford housing. It could even be like an earthquake or flooding or something that caused them to be homeless. So what they're really worried about, let's go back here. The poor individuals, the homeless patients, they're concerned about the present. They're just concerned about surviving. Whereas the middle class clients are concerned about the future. And what's going to happen in the future. But in these homeless individuals, they just want to survive. They just want to have food on the table for the day. So they're insecure, right, about foods. They don't have a place to store or even cook food. So what do? They go to soup kitchens. They might have food stamps. They might have to look in the dumpster for food. Sometimes they don't eat and they give their kids food. So it's really, it's very sad, right, to see that they're struggling just to eat. And they want to eat healthy. It's not like they don't want to. They even know how to eat healthy. It's just that they can't afford it. And these individuals that are homeless, they have, facial pain. Their feet are hurting. Their face, they could be having pain on their face. But it's just that they can't really afford dental care, unfortunately. So if you do have a homeless client that, you're fortunate enough to see, what dietary suggestions can you make? Well, you can, whether they can afford it or not, you can encourage them to take a multivitamin if they can't afford it. That would be amazing. Teach them about what's good to eat and what's bad to eat in terms of cavities. Tell them that we want lots of good saliva and we want food that's going to stimulate saliva. So eat cholestatic food like nuts, hard vegetables, chewing on gum. chewing on gum with xylitol. Xylitol is sugar-free. Substance abuse. So, drugs, alcohol, tobacco, those are the 3 most abused substances. And so sometimes, if we continuously abuse it, which means that if we just indulge in it too much, if we have too much of it, it can impact the oral health. And then it can sometimes, not all the time, but abuse, if we have too much of it, sometimes it can lead to addiction where you're dependent on that drug, or you're dependent on that alcohol, you're dependent on that tobacco. And so there's no cure for addiction, but you can learn to manage with the addiction and prevent that relapse. So people who are abusing drugs, alcohol, maybe even tobacco, studies show that they could have poor oral hygiene. They could neglect their oral hygiene, so they don't care about their teeth that much. They could be grinding a lot, and what happens is they could their diet usually consists of carbohydrates. This is because if they're trying to manage their addiction, for example, or their abuse, and decrease the amount of drugs they're having, they're going to replace it with food. And what food are they going to have? They're going to have carbs. So whenever you're replacing a drug or a tobacco or something, you're going to replace it with food, and the food will tend to be carbs, which can lead to cavities. So if we're trying to make recommendations for these individuals that are taking drugs and tobacco, what you want to do is encourage them to take a daily supplement, so multivitamin, because they might not be getting enough nutrients in. And they might want to snack a lot, because if they have that craving, instead of, doing drugs or instead of going for alcohol, they'll eat, right? And so if they're eating, encourage healthy snacks. We want to make sure that the acid, PAP stands for potential acid production, which means that you just want to keep that acid in their mouth a lot less. So if they're snacking a lot, you're going to get more acidic environment in their mouth. So you want to keep it very low. You want to keep the acid in their mouth very low. So to do that, encourage them to eat food that cause or stimulates saliva, so hard foods, or chewing gum that always stimulates salivary flow. So this is about methamphetamine abuse, or meth. Okay, so when people have meth, it can really affect their teeth. Let me show you. I want to show you guys a picture of meth mouth. Look at that, like rampant, severe caries. And so the teeth that are mostly affected are, I know doesn't show this the max central as being affected, but the max central are very common to get affected with meth mouth, and same with the posterior molars. So max centrals and posterior molars are the ones that are, like, that's where you see a lot of cavities for meth mouth. So why do people use it? Why do people use meth? It's because it gives them that high the happiness, the euphoria, so intense happiness. They get lots of energy. They don't feel as tired, but unfortunately it leads to meth mouth, right? Which is this. We're concerned because this causes very fast developing rampant caries. Like, cavities happen really fast, and it really crumbles the teeth. And we could get like tooth fracture. We could get like tooth loss, like an erosion, because it's so acidic. Meth is really acidic. It can even dry out them. They could also be grinding a lot, and it causes muscle trismus, where you have a locked jaw and then you can't close your mouth. That's what trismus is, where you can't close your mouth. So what can you do? We know that meth causes xerostomia, right? So meth which means it causes dry mouth. It also causes a lot of cavities. So when you have dry mouth, it's going to cause a lot of cavities. Individuals who, take meth drink a lot of soda, and that's because they have this craving for carbs. So anytime you want to have carbs, usually people tend to have soda with the carbs, and so individuals with meth drink a lot of soda. So just try to imagine this: if they have dry mouth, they snack on a lot of carbs, they drink soda. So I'm just thinking like weak enamel. I'm thinking cavities. I'm thinking a lot of cavities, rampant caries, and so. Individuals with meth mouth have mouth that looks like this. And so when you have clients like that, maybe ask them to do a 24-hour diet recall, and you figure out what the most destructive diet habits are. and then figure out ways to decrease those damages. You cannot necessarily encourage, ask them to eat healthy. Like that not right now their concern because they're addicted to meth. Once they once they controlled their addiction for meth, then you can talk about healthy nutrients. But for now, just figure out what they can do to kind of decrease the caries. So maybe like replace soda with something healthy, and then once it's controlled, once they have once the patient is in recovery, I should say, then we can make better recommendations, healthier recommendations. But for now, just concentrate on the worst thing that they're doing and seeing how we can help them with that. So with these individuals that have meth, we can, instead of soda, maybe you could suggest tea with like xylitol or with like a sweetener instead of sugar. Maybe they could have Ensure instead of soda, so they're getting all their nutrients. And encourage them to drink a lot of water and rinse their mouth often because their mouth is going to be so acidic. And then again, well, like I said, when the patient is in recovery, then we can make the appropriate suggestions for their nutritional health.